And thanks for being with us. This is VaxTalks. I'm Brad Satin, joined today by Dr. Mark Schleiss. He's a professor of pediatrics at the University of Minnesota Medical School. Dr. Schleiss, thanks for being here.
It's great to be with you.
Today we're talking about COVID-19 and specifically the impact it could have on children and pregnant women. So let's get started with kids first. Right now, the vaccine is not approved for kids, right?
Yeah, that's right. We do not have an indication for vaccines except for children over the age of 16, adolescents. They can be immunized with our current vaccines.
Are there clinical trials underway right now for younger folks?
Yes, there are. As you know, currently 2 vaccines licensed in the United States, and both of them are in clinical trials in children and adolescents. In fact, there is a trial anticipated that will enroll children as young as 6 months of age. So there's good progress being made in evaluating vaccines in children.
Very good. You know, we hear on the news right now that for kids, it's a mild disease. So is there a verdict out on whether kids should get vaccinated?
Well, I think that as time moves forward, we absolutely have to immunize children. Children play an essential role in cycles of transmission of COVID-19. And although it is true that the illness is less severe in children, there have been multiple cases of very severe illness and even death in children. And so COVID-19 is not innocuous. In fact, just last week in the New England Journal of Medicine, there was a very important paper published by Drs. Perry Klass and Adam Ratner with a provocative assessment of the impact of disease in children. We've seen many deaths in children in the United States, approximately 250 overall. And so we may consider COVID-19 to be mild in children, and usually it is. But every one of those deaths is a tragedy and could be preventable with vaccines in children.
Yeah, makes sense. We know that many Americans just don't trust the COVID vaccine at this point, worried about safety. You obviously have to get parents on board for kids to take it. What concerns do you see there?
I think the concerns that parents have for their children mirror the concerns that they have about getting themselves immunized. Is it safe? It's a new technology, so is this something that we just don't know enough about yet? But the remarkable thing about COVID-19 vaccines is the incredible track record of safety that we've seen in these short few months that we've been immunizing. The CDC published a summary of vaccine safety just last week, and out of several million doses that have now been administered, the risk of side effects is incredibly low. In fact, 14 million doses reported in this paper, 7,000 adverse events. That's one adverse event for every 2,000 people. And those adverse events are transient and self-limited. Headache, fever, some arm soreness, some fatigue. Those are the things that are described. When COVID vaccines first came out, there was a lot of discussion about what we call anaphylaxis, a severe allergic reaction to the vaccine. But in fact, we know that the anaphylaxis is extraordinarily unusual as well. And so I think compared to almost any other vaccine that we've developed in the last 50 years, COVID vaccines are among the safest, if not the safest. So this will be really an important message to drive home when we expand immunization to children.
It's good news. If we do vaccinate kids, when should it be given? At what age do you think?
Yeah, we don't know yet. I think that what we will probably do is have a phased approach that will begin by targeting adolescents. We know from some school transmission studies and some childhood transmission studies, the transmission in adolescents seems to be more common than in young children. And so I think that what we'll be seeing is an expansion of vaccine efforts for adolescents by the end of this year, by the end of 2021, and then probably moving the vaccine back to young children, school-age children, and maybe even infants and toddlers in 2022.
Let's talk about schools for a moment. With certain diseases, you have to show a proof of vaccination before a child can go to school. Should a COVID vaccination be required to attend school?
Yeah, it's a great question. I think that will be a decision that will emerge over time. I think we need to continue to see the impact of COVID-19 in our communities and in our country over the next 2 or 3 years. I don't think any of us believe that COVID-19 is going to disappear. We're going to continue to have issues with this virus and this infection, maybe for the foreseeable future. But we don't require influenza vaccination for children to attend school. And so we probably won't see any requirement for COVID vaccine in children. But I think this is an important issue to watch over time.
Let's move now from children to pregnant women. Does a COVID vaccine pose a higher risk to a pregnant woman?
There's no data, no information that says that it's risky for pregnant women. And I think this is a major myth that we need to dispel. There have been few trials of vaccines in pregnant women, but there have been a lot of pregnant women who've received the immunization already because they're in the highest tier of risk, they're healthcare providers themselves, and there are no reports of any adverse events related to vaccination. We have to remember that we have strong precedent for safe, effective vaccination during pregnancy with the whooping cough vaccine as well as the influenza vaccine. Right now, it's recommended that women should receive these vaccines during their pregnancies. And I think we'll see a similar indication emerge for COVID-19 vaccines. In fact, there are several studies ongoing right now specifically examining vaccination during pregnancy. A pregnant woman is at severe risk if she gets COVID-19, not only for her own health, but for that baby's health. That baby may be at a higher risk for premature birth or other kinds of pregnancy complications. So we immunize pregnant women not only to protect them, but to protect the health of their unborn infant as well.
Well, as more of these vaccines do get approved, is one better than the other for children or pregnant women?
I think that right now, as we look at the pipeline of vaccines that are either licensed or approaching licensure, they're all equivalent in terms of safety. We also need to be cognizant of the fact that we still are having a lot of challenges rolling out COVID-19 vaccines in the United States. And so my advice is that the COVID vaccine that you should get is the one that you can get today, the one that you can get your hands on, the one that you can receive. They're all equivalent in terms of safety and protection against hospitalization and death. And so I think the highest priority should be to get vaccinated with whatever is available to you and not to let small differences in efficacy dictate your decision about being immunized.
Really valuable information. Dr. Schleiss, thanks so much for joining us.
It's been my pleasure. Thank you.
And thank you for joining us as well. This is VaxTalks. And for more information, go to whywevax.org.